Recognized.
I listened to my colleague from Kentucky, but I just, as much as I respect you, I totally disagree with what you've been saying here. Under the public law right now, the emergency, when it starts, when it ends, is done by the administration. Specifically, the Secretary of Health and Human Services, I guess, recommends to the President. And there's a reason for that, and that's because he gets all this information from various sources about the science, about when we should be doing this. And so I disagree to say that we, as the Congress, should be the ones that make that determination either to begin or end. But in addition to that, the gentleman from Kentucky mentioned in response to one of my Democratic colleagues the provision that we passed in the last Congress in the Inflation Reduction Act to negotiate prices for prescription drugs under Medicare. The fact of the matter is that wasn't a cut to Medicare. That was a way of trying to make drug prices more affordable for our seniors. To suggest that somehow that's a cut, I don't think is accurate. I mean, this is a major savings to seniors out of pocket once this program goes into effect. And, by way of background, again, some of my Democratic colleagues have stressed that we hear constantly from the other side of the aisle this idea that, that the Republicans are going to, refuse to raise the debt ceiling unless they can cut Social Security or Medicare or Medicaid and other vital programs. They seem so determined to cut Americans' health care that they're willing to recklessly risk defaulting on the national debt and wreaking havoc on the economy. So again, it's the same thing here. What we're saying is if you cut off this public health emergency earlier than what the president is suggesting under this bill, you end a lot of programs that are very important. Continuous eligibility for Medicaid, 20% cut in hospital payments, free testing, free vaccines. I mean, all this ends, and it makes no sense, in my opinion. We should be trying to do what we can to help American families and make the right decisions based on the science. And I reserve the balance of my time.
The gentleman